Now, if I tell you that your body heals itself and that typically in 6 to 8 weeks, soft tissue injuries will heal, it still doesn't really help you to get over the frustration of having to deal with this every day. And every day you're trying to do the things that you're usually able to do, and it still hurts and you're frustrated again. I made a whole video recovering from soft tissue injuries where I really gave you very clear things to do and which exercises to do and what to stay away from and how to stretch and how not to stretch. A lot more of how not to stretch. But the principle is simple. Just try not to make it worse. Try to stay mobile and try to deal with the frustration because it's going to be hard. And in some cases, it is depressing, particularly if the injury makes it hard for you to walk. And you will find that day to day, you keep thinking like, okay, this did actually get a little bit better. So I am on the right track, but it's still so slow. And it does feel like it's taking forever. It makes it hard for people to really stick with the recovery and to stay careful. Because as soon as they have a day that's a little bit better, they try to do all the things they used to. And then, of course, the day after that, they're back in pain, and then they just lie on the couch and suffer. And only lying on the couch doesn't help heal either because you still need the blood flow, you still need the mobilization. So it's really about staying very patient. So if you want to get treatments, sometimes getting a good massage can really be helpful in that period. Sometimes getting chiropractic adjustments can be great, or getting acupuncture sessions. All these things can help you not only heal, but also feel like you are in this process. Going to get these appointments can be a bit of a psychological crutch because you feel like, okay, I'm taking care of my body. So even though I'm saying this fixes itself and don't waste your time and money, well, in some cases, it does help you to get this little nudge that just makes it better a little faster. All I want you to do is be very careful that it really does help. If you're going to try to get something fixed and they're manipulating you way too forcefully, they might actually increase the injury. So work with somebody who listens to your feedback. Work with somebody where already when you're in their office, your whole body feels like, oh, this is good for me. So go really by the sense of during the treatment, right after the treatment, it has to feel right for you. You have to get the sense like, this is actually good support. And then, of course, you can keep going with it. But you don't have to run in 3 times a week. Make sure that you're getting a little bit better. Make sure that you don't do too much too soon. And find a way of dealing with the frustration. Find something to do that is outside of what you usually do. Maybe you get back to reading books. Maybe you find something to binge watch on Netflix. Just make sure that you get off the couch often enough that you're not in the same position for several hours, and find a way to have patience. Understand that this is always frustrating. We all hate it. We all feel like this is the major disruption of our life. And in some cases, it can really feel existentially damaging. So I know it's hard. And I know that even though it is kind of not as bad as other conditions, and you're not going to die, and we all know that, you still feel really damaged. And in some cases, it's the first time that you ever felt helpless. So honor these feelings, call your best friend, say, oh, I'm so tired of this, I don't know what to do anymore. And then settle in for another day, look back, compare to the week before, make yourself aware that yes, actually, this did get better. Yes, actually, I am on the right track because it's going to continue that way. And I promise you, 3 months down the line, you're going to look back and it's just going to be a bad memory.